Hey everyone, today we're tackling a really important part of comfort care, palliative oxygen therapy. We're going to look at what the latest guidelines say and what really helps when someone we care about is struggling for breath. So let's dive right in.
So picture this. You're with someone you love, and they are just fighting for every single breath. It's awful. Your first instinct, right, is to do anything you can to help. And so often, that instinct points to one thing, oxygen. But is that always the right move? That's the huge question we're unpacking today.
And look, that reaction makes total sense. Watching someone you care about struggle to breathe is one of the most stressful, heart-wrenching things you can go through. That desire to grab an oxygen mask, it comes from a place of love and compassion. You see a problem, and oxygen feels like the most obvious, direct solution.
So let's actually take a closer look at that obvious answer. You know, in medicine, when oxygen is used specifically for comfort, it has a name, and its purpose might actually surprise you. It's called Palliative Oxygen Therapy, or POT for short. Now the key word here, the one I really want you to focus on, is sensation. This therapy isn't really about fixing a low number on a machine. It's about treating the feeling of being breathless. And trust me, that distinction is absolutely crucial.
I mean, the logic seems pretty solid, doesn't it? If a person feels like they can't breathe, giving them more oxygen should fix it. It just seems like a straight line from problem to solution. But in palliative care, sometimes the straightest line isn't the best one. So let's see what happens when we put that assumption up against the hard evidence.
So, what does the research actually show? Well, this is where things get really interesting. The findings are, honestly, pretty surprising, and they can fundamentally change how we approach providing comfort.
Okay, so this right here, this is the core finding. Lots of high-quality studies have done a direct comparison. They gave some patients palliative oxygen and other patients just regular, purified medical air. And for patients who weren't actually low on oxygen, the results were pretty shocking. There was no real difference in their relief. It seems the benefit wasn't really coming from the oxygen itself, but more from the feeling of air flowing and just the comfort of receiving some kind of treatment.
And this research, well, it's led to some incredibly strong official guidelines. This is a grade A recommendation, the highest level, from the British Thoracic Society. It basically says that for patients whose oxygen levels are stable, at 92% or higher, palliative oxygen should not be the first thing we reach for to treat that feeling of breathlessness. That's a really, really definitive statement. So why? How can this be? It's because that feeling, that sensation of being out of breath, which doctors call dyspnoea, is incredibly complex. It's an experience that's cooked up in the brain from all sorts of signals, not just from your lungs. Things like anxiety, muscle tiredness, they all play a big part. The research is pretty clear that the numbers on the monitor often don't match up with how breathless a person actually feels. And importantly, the evidence shows that other treatments, like a low dose of an opiate, are often way more effective at calming that feeling down.
So, if oxygen isn't always the answer for the feeling of being breathless, then what is? Well, the guidelines point us down a different path, one that can lead to much more effective comfort care. Let's make this super practical. Imagine your loved one is clearly distressed. They feel like they can't get a good breath in. But the nurse comes in, checks the little monitor on their finger, and says their oxygen level is stable, it's at 94%. This is that exact moment where this new understanding of care really comes into play.
Here's what you should expect from a care team that's following the evidence. First, they're going to check for any other treatable causes. If they don't find any, they might suggest trying a low-dose opiate. Remember, that's a grade A recommendation. And finally, they'll probably recommend some really simple non-drug therapies that can provide a whole lot of comfort.
Okay, so what are these other therapies? A trial of opiate medication is, of course, a top recommendation. But beyond that, you're not going to believe this one. Research has shown that something as simple as a small handheld fan pointed at the face can bring remarkable relief. Seriously, the cool air hitting the cheeks seems to send a signal that calms down that sensation of breathlessness. It's simple, it's safe, and it is surprisingly effective.
And this all leads us to the most important part of all, how you can actually use this knowledge. This is all about empowering you to be a really effective advocate for your family on this care journey.
So, the single most important takeaway is this. We have to separate treating a number from treating a feeling. If the blood oxygen number is low, that's a medical problem that needs treatment, and oxygen is absolutely the right tool for that job. But if breathlessness is a sensation that's happening while the oxygen numbers are perfectly fine, we need a different set of tools designed to treat that feeling.
So to help you navigate all this,
Here are some really concrete questions you can ask the medical team. Asking things like, is their breathlessness actually caused by low oxygen? Or could we maybe try some other therapies, like that fan you mentioned? It shows you understand what's going on. It helps focus the conversation not just on doing something, but on doing the right thing for your loved one's actual comfort.
At the end of the day, it all comes down to this. Palliative care is all about providing the absolute best quality of life possible. And by understanding that oxygen is a specific tool for a specific problem and not a magic wand for the feeling of breathlessness, we can make sure that we're providing the most effective and truly compassionate care we possibly can.